Well, the Alabama Department of Health says the Centers for Disease Control has sent back preliminary positive findings on 4 Alabama residents for the chikungunya virus. 2 are from Colbert County and the others are from Jefferson County and Tuscaloosa County. This is a mosquito-borne virus, so should you be alarmed? Joining us this morning for some perspective and some tips is Dr. Ed Kahn from the Jefferson County Health Department. Good to see you this morning, sir.
Yeah, thanks, Mike.
Well, first of all, we should point out that the CDC and the State Department of Health are the organizations that have details on the cases in Alabama. But talk about chikungunya in general. What do we know about this?
Well, it's a viral infection. It's transmitted by mosquitoes. It's a type of mosquito called Aedes mosquitoes, the same ones that transmit dengue fever. It's so far confined to tropical climates. It's been prevalent in Africa and Asian countries for many years, but as of late 2013, the disease started appearing in the Caribbean islands, and there's been a number of big outbreaks in different Caribbean islands throughout this year. And we've been seeing increased cases in the United States from travelers returning from either any of those destinations, particularly the Caribbean.
So we should point out then, because I know your office has been getting a lot of calls from people, hey, I'm going to be outside, I'm going to be barbecuing or whatnot. Should I be concerned? Should they be alarmed?
No, it's a disease that's confined to these tropical destinations. So if someone's a returning traveler from one of those places develops a febrile illness with rash and joint pains, they should be concerned and see a physician. But if somebody is just in Alabama or in the continental United States, there's been no transmission within the U.S. as of yet.
And really, there are other things that can be transmitted by mosquito bites, even in our state and our country. Talk about those, because those are a bigger concern, right?
Yeah, we do have, other diseases like West Nile virus, Eastern equine encephalitis virus, St. Louis encephalitis virus, and those are transmitted by mosquitoes that we do have here. So it's still important to take mosquito protection here in Alabama.
Talk about it. So what should people do to be prepared?
Well, good bug spray is effective. Typically recommend something with DEET, at least 30% concentration of DEET in it. Protective clothing if there's a lot of mosquitoes, out with like long sleeves, long pants. If there's a heavy mosquito burden, you can use permethrin in the clothing. And
permethrin-treated clothing, okay. Empty standing water, and those are all good tips as well. You mentioned too that some people though may have some health concerns for DEET, what the causes it might have. So what are some other alternatives then for them?
There are some other compounds that can be effective. DEET is generally felt to be very safe in those concentrations, 30%. Okay. But there are some other insect repellents.
Okay. So now, but back to chikungunya, if somebody does have some symptoms, talk about a few of the symptoms, and what should they do? Should they get help immediately? Is this something they can delay?
So if somebody's concerned about that they have chikungunya, I mean, again, it would be someone who's returning travel from an area where the disease is prevalent. Right. It most of the time is a self-limited illness. It can be very painful, especially the joint symptoms. They can get an arthritis at times, and it can be very severe, very disabling. Tends to be self-limited, 1 to 2 weeks of the illness. Rash, they may get a rash, a lot of body aches, headache, that sort of thing. Right. But the concern is that it could still be something else. So if someone's a returning traveler, they want to make sure they don't have dengue fever, malaria, typhoid, some of the other diseases which can be manifest in a similar way and be potentially much more serious.
Because there's no vaccine, though, for chikungunya, right?
No.
Okay, so that's always a concern as well. Well, I appreciate your help, and hopefully you've alleviated some people's concerns that they're going to go out and get bit by a mosquito and get the chikungunya. But again, there are other health concerns about mosquitoes that they need to be aware of, so I appreciate that. If they want to get more information, because this is a holiday weekend, or if they have some concerns, is there somewhere they can go to get more information?
Yeah, they can contact the health department, and they can get some information.
Okay. All right. Thank you, Dr. Kahn. Appreciate it.
All right.